because it's an experimental treatment, you only give it to patients who are on the verge of death. And that's what we were doing in the beginning.
Until we have a true cure for COVID, doctors are trying what they can to help people heal.
We have been talking a lot about convalescent plasma during the pandemic. It's using plasma from someone who's recovered to help treat COVID patients. Carissa Planup is live with more on the push to prove whether it really works. Carissa.
Jared, keeping people out of the hospital is what's key here. Here at Valleywise, the number of COVID-19 patients here in the hospital has doubled in the last 10 days. Convalescent plasma has been used in conjunction with a number of medications to keep someone alive, but how effective it is on its own is still a mystery.
I'm optimistic that it'll work because it works in other diseases. But as we know, COVID-19 is kind of a different animal.
Dr. Frank Lavecchio, principal investigator of a study that will try and see if people who come into his ER with mild symptoms can receive convalescent plasma and get better.
And we also hope that they're less likely to be admitted to the hospital should something go wrong.
There's not a lot of good data that shows convalescent plasma really works on COVID-19. Lavecchio says that's because the treatment is often one of many used on patients so sick they might die.
Essentially, we're throwing everything at them. Another way to say it, we're throwing the kitchen sink at them, all of these experimental kind of medications, trials, etc., to see if something works. I can't convincingly say in this disease that it definitely works.
The study is looking at patients age 50 and up who were recently diagnosed with COVID-19 and have health issues that might prevent them from recovering. Some will receive the convalescent plasma. Others will get a placebo, in this case, a vitamin infusion. Lavecchio expects the study to take 90 days and shed new light on this experimental treatment.
We do want to return to normal like everyone else.
Well, previously, doctors didn't have enough of that convalescent plasma to give it to patients with mild symptoms. But Dr. Lavecchio tells me after months now of this pandemic, they do have enough donations to really study convalescent plasma and its impact. Reporting live in Central Phoenix, Carissa Planup for Arizona's Family.